Welcome back to Exercise Thought Physiotherapy, where we exercise the mind and educate the body. To celebrate 6 months in Ringwood, this month of February 22, we are producing this educational and empowering video, a self-help guide to treating discogenic back pain. Discogenic back pain is the most common presentation that we see at Exercise Thought, and back pain is, according to published research, the most common and the most debilitating musculoskeletal pain, not only across Australia, but worldwide. So please, let us know if we can help you at all with your back pain. But our priority with this video is not to sell physio consults, not to get you into the clinic. It's to help you help yourself, so that if you pick up this video and anywhere in the world, you know exactly what to do to diagnose and to treat discogenic back pain. Someone who's very close to me recently had some discogenic back pain and didn't ask me about it for 4 days, and we probably could have reduced the amount of pain and suffering they had if they had access to a guide like this and thought to YouTube or Google how to fix back pain or something like that. So please just start off with a bit of anatomy. There's the key structures in our spine. There's the bones that stack on top of each other and the discs in between those bones. There are some nerves that run all the way down from the brain, all the way down the spinal cord into the legs. The most common type of pain we see is the disc pushing on the nerve in between those bones. Hopefully there's some anatomy that you can follow on this video as it's going through production. And you can imagine that disc, if we hold in this position, is going to be under some strain because it's a rubbery structure, and this is quite a bit of weight, head, shoulders, arms, like this, which is why often it's lifting kind of stuff, especially if someone's not prepared their body properly for the lift, or prolonged sitting and prolonged driving is another cause for this kind of pain. If you could think about this kind of posture, bending forward and having load on the disc, or sitting down and slouching along, that can irritate the disc as well. Things that tend to ease your pain, if you've got discogenic pain, things that will make your pain reduce or resolve your pain would be standing up, going for a walk, and positions that get you into more what we call lumbar extension, which is this position here. We'll put some photos up about the Menezes protocol. Robin Menezes, a New Zealand physio, encouraged people to lay supine or with their elbows propped up, or to lean back like this as a first port of call to reduce discogenic pain in the early phases. So hopefully that helps you to identify discogenic pain. A couple of red flags, a couple of nasty things to look out for. Please do chat with a physio or a doctor if you've got any of the following. These are what we call red flags. So if you can't empty your bladder, if you have ripping pain right down the back of your leg, from the back all the way into the leg, if you've got that, if you have numbness over the genital area, if you have a history of cancer, and if your symptoms don't behave mechanically, if your pain doesn't change with changing posture or changing movement, if it's constant no matter what and seems rather unpredictable, then have a think about something sinister. Also, if it feels like a bit visceral, a bit organy, there is some kind of back pain that can refer from certain organs. Ovarian cysts is something that I've seen refer, but also any other kind of intestinal problem. You can imagine the intestines are very close to the back, so they can refer around. Anyway, that should help you to get started in diagnosing discogenic pain. Please don't sue us if you make the wrong diagnosis. It's your responsibility to look after your body. The treatment is the next part. So we talked about the extension protocol, so easing back like this, which means walking and standing more, laying down on your tummy with elbows propped up, or just laying down. The things that are going to hurt so the one you want to reduce would be reduce sitting down, especially no slouching, reduce driving long distances in a car, please also reduce the amount of weight that's going through your spine. So, heavy squats with a bar on your shoulders, carrying around heavy weights, that kind of stuff's going to put more stress on the recovering disc, and they do recover. There's good research to say that within 6 weeks, that these discs are beautifully recovered based on imaging results. We'll see if we can put a research publication up for you on the video. And we do know that the discs are wonderful self-healing structures, so there's nothing to be afraid about. Just practice identifying it. Please put any questions that you've got in the comments. We will answer them, and if you have answers for the comments, please answer the comment. And if you agree with the answer, please support that answer. It's a democratic process, isn't it? So, like the comment and whatnot. Yeah, that's about it actually. Let us know if you've got any questions. You know how to find us, but really, hopefully you don't need to. Hopefully this video does it all. So let us know if you have any questions about discogenic back pain. Hopefully you can now diagnose and treat discogenic back pain yourself, so that if you have this kind of episode in the future, you know what to do. And this is particularly meant for people who are experiencing discogenic pain, or experiencing a loved one or witnessing a loved one who might be experiencing discogenic pain. So hopefully it helps, and this is the first one of our self-help videos, so please give us some feedback if you think we can improve, or if you want to know more.